11:04 on your Saturday morning. Yeah, a beautiful, crisp, and bright Saturday morning. You want to call in? Dr. Lou is here. It is 416-870-6400, star 640 on cell. Going to cover a bunch of stuff today. If you're in pain, if you're getting over some pain, want to know how to treat your pain, you've come to the end of your rope as far as treatment is concerned. You want to look for something alternative. Maybe Dr. Lou could assist you. It starts with a phone call this morning. You want to give us a call, info@paincarecanada.com. You want to send us an email this morning. We got 2 hours today, so we're going right till 1 o'clock. So there you go. How you doing, buddy?
Good, you?
Good, man. How was the week?
It was good. Yeah, I was in Phoenix last week. It was nice. Yeah.
How was that? Hot, sunny, steamy? Okay.
It was a little cold. It was a little cold. I went to the desert for cold, but no, it was a nice trip. I went to see my brother. Yeah.
Good. Hurt yourself?
No.
So you're okay?
No, lucky guy. I'm not hurt at all.
How was the week, other than Phoenix and work? I mean,
Good. I got back and I've seen some patients and kind of what you were just talking about with people giving me a call, and a lot of the things that I'm starting to see now as a result of this show is a lot of second opinions. People just kind of want to know if the course they're on is the right course, if there's anything else that they should be doing, et cetera, et cetera. And again, in seeing and doing these assessments, what I'm finding are a lot of flaws that healthcare practitioners are making out there. I had a gentleman actually yesterday who came to me. He's complaining of numbness in his pinky and his ring finger on the right side.
Okay.
And he was told by his family doctor that it was likely just an ulnar nerve. And it's something that drives me crazy because an ulnar nerve is an anatomical structure. It's not a cause of pain, right? So a lot of times people say, yeah, I have an ulnar nerve. Well, everybody has an ulnar nerve. An ulnar nerve what? So when you look at, we've talked about this a lot of times, when you're looking at numbness and tingling, you got to consider what's potentially causing that. It could be something like a peripheral entrapment, which just basically means that somewhere in that upper extremity, there's a tight muscle or a tight joint that's impinging on the nerve causing that. It may be something more central towards the spinal cord, like a disc herniation affecting the nerve root. It could also be something within the spinal cord, like a cyst. It could also be something neurological and more serious, like MS or et cetera, et cetera. So he presents to me, he's talking about this numbness and tingling. And yeah, it seems very much like an ulnar nerve entrapment, something to do with tightness in the forearm. And as I'm speaking to him more, one of the important things that we always like to ask about is, what's your past medical history? Tell me a little bit about yourself. And he says, yeah, I'm a pretty healthy guy, but last year I had a TIA. A TIA is a transient ischemic attack, which is a mini stroke, right?
Oh, okay.
And I was like, okay. And one of the symptoms of stroke is these types of things, right? Like neurological deficits. So I said to him, tell me a little bit more about what happened that day when you had the TIA. He said, well, I went to sleep. I was totally fine, no issues. I go to sleep. I wake up around midnight, he says, to go to the washroom. And I can feel that my right arm is heavy and numb and I can't lift it and whatnot. And I say, okay. And I said, and that's the same arm you're complaining of symptoms today? Yes. And I said, okay, what did you do after? He said, I went to the washroom. I went back to bed. I said, okay. He says, I woke up the next morning and my arm still felt funny. And so, I still went to work. I did my day-to-day stuff, but then I was a little bit concerned. So I went to a walk-in clinic. Walk-in clinic said that I may have had a mini stroke, sent him to the hospital, got some imaging, ended up seeing a neurologist. And yes, it was confirmed that he had a mini stroke. However, the big flaw that I hear in this story is nobody explained to him what a stroke was, number one. I had to sit there yesterday and kind of explain to him what the pathology of a stroke is. And no one also explained to him that potentially, because that was the arm where he originally had the symptoms, that he would have needed some type of rehab in that area so that neurological deficit that he's now feeling is not prolonged over time.
Yep.
And so, just based on a good history, no special testing I had to do. I just had to talk to a patient, which I think is something that's missing in healthcare nowadays. It's often do this test, do that test, and no one bothers to sit with you and speak with you and hear you out and become a detective. And so through all of this, I was able to figure out, probably what's going on, because then I tested him for other things and there were no other things. And so it's probably just some residual issue from the stroke that he had last year, but at least now he has answers. right? And it doesn't mean there's nothing that can be done, but at least he starts to understand the etiology, which means where did this all start from?
That's nice.
And so he very, very happy is coming. He's going to follow some treatment that I've recommended, follow up with me. And it's sad to hear these types of stories where people don't get things explained to them the right way, that people just dismiss it like the family doctor saying, oh, it's just an ulnar nerve, whatever, right? Well, the family doctor knew he had a stroke. He's an educated professional. He should be able to put 2 and 2 together there.
Big time.
Yeah.
Well, we'll squeeze Mark in before the break. Hey, Mark, how are you, pal?
Hey, not bad. Thank you again for doing this. It's a great service you guys are doing.
Appreciate that. Go ahead.
My question is, I just recently got diagnosed with high levels of uric acid. Mm-hmm. And I've looked up the top 10 things that you eat that contributes to it, and I don't do practically any of those things. I'm just wondering if there's anything that I can maybe start eating that might counteract uric acid or reduce my levels?
To reduce your levels, again, all these types of things, when you're looking at high levels of anything, it's a matter of trying to figure out, well, what's causing those high levels. Uric acid is it's a metabolic byproduct, so it's something that. Have you ever had gout?
No, but apparently my doctor said that most definitely I'm at a level of 600.
Okay.
And he said that definitely is a sign that I'm either going to have kidney stones or gout coming.
Yeah, and so I was just going to say that, gout and kidney stones are two potential things. Now, that doesn't mean it's always going to happen. But, you may also have something like diabetes going on that you don't know yet, and diabetes can affect uric acid levels. So are there specific foods that can counter uric acid? I can't think of any off of the top of my head. But what I can tell you is the more important question, I believe, for you is figuring out why are those levels high, right? And trying to get an answer. The other thing about a lot of metabolic breakdown and different minerals and things that we have in our body. Some people just have high levels, and it's just genetic. I actually have very high iron levels, which can be
my sister-in-law's got low iron levels.
And high iron is called hemochromatosis, and it's just a genetic thing. And so, again, high iron levels can be a scary thing when it's picked up on blood work if there's other signs and symptoms, because it may be a symptom of like an early cancer or something like that. Mm-hmm. But when I noted that I had this, I just went through the right testing to make sure, okay, is this just benign or is it something more serious? And I would encourage you to mark that this is probably something, get it checked out, make sure there's no other cause for why the uric acid is high. And if it's, and if there's no other cause, then, usually, the foods that will cause uric acid. And probably avoiding those is probably the best thing.
Which he's doing, yeah.
Yeah,
so
and you're already doing it. Right? But sometimes it's also about just cleaning up your diet really well. And that means a lot of fruits and vegetables and limiting the protein, limiting the carbohydrates. And that usually is the type of diet that helps a lot of different things.
Thank you.
No problem.
Cool. Thanks, Mark. We'll take a quick break. 416-870-6400, star 640 on cell. A 2-hour edition of the Dr. Payne Show here till 1 o'clock. Give us a call. We'd love to talk to you on this beautiful Saturday morning right here. The Dr. Payne Show continues. Talk Radio, AM 640. 11:15 Saturday morning. Yeah, we got wide open lines. You got some pains, got some problems, issues, questions you want answered. Bring them on. Dr. Lou is here till 1 o'clock this morning. Wife sore today. Gets up her back. She's got sciatica. It's always sciatica.
Yeah,
I've got sciatica.
Always sciatica.
What is that? Well, it's a thing, but everybody just kind of lumps it into one label, right?
Yeah. And it's funny. I try to educate my patients on this, and I also teach. And when I teach my students, I try to make them understand, because oftentimes in healthcare, we're told clinical signs that we believe are diagnoses. Similar to Mark, who just called and said, I was told I have high uric acid. That's just a clinical sign. That's not a diagnosis of what's causing a problem, right? Similar to if you went, you had flu-like symptoms and then someone told you have a fever. Just a clinical sign, right? And sciatica is the same thing. It's closer to a clinical sign and symptom than it is a diagnosis. What sciatica is that the sciatic nerve is somehow irritated from something. That something could be similar to what we were just talking about with the ulnar nerve. It could be something like a peripheral entrapment where maybe there's a tight muscle around the sciatic notch impinging on the nerve, or maybe it's a disc herniation causing that, or maybe it's something within the spinal canal itself, like a stenosis, or it could be something neurological. So again, sciatica is just a symptom and a clinical sign of pain in the sciatic nerve. Most oftentimes when people complain of it, it is due to some type of a low back problem, which is either going to be some type of a disc herniation or some type of a tight muscle. And then, in more serious cases, there's other causes, but that's all it is. It's irritation of the sciatic nerve. And the harder part is when you talk about treatment, and I get this question a lot, is how do you treat your sciatic nerve?
Right.
Again, it depends on what's causing the irritation of the nerve. And then once you know that, you have the right treatment, right? Because the right diagnosis equals right treatment. And I've said that all the time. And a lot of the times what we're trying to do is every time we see a patient, we try not to, put all our eggs in one basket and say, you absolutely have this.
Yeah.
You always want to have a couple, what we call differentials, where you say, okay, this is what's most likely, like 95% sure this is what you got, but it could also be this and this. And so we're going to treat it according to option A first, but we're going to keep monitoring you. If things change, we may start treating what option B and C would require, just so that you're actually getting people better.
Does that count as far as sciatica is concerned, whether it's left, right, or center?
In terms of what?
As far as diagnosis, that could change depending on whether it's right down the center of your back or on the side of your lower back above a kidney, right?
Right. With sciatica, usually if you have pain in both the sciatic nerves on either side, that's an indication that it's probably more due to something in the spinal canal. Because if you look at the anatomy of the vertebrae and the way the nerves come out, if it's something like a disc herniations tend to favor one side and would only cause pain on one side. But it's very common when people complain of that bilateral or pain on both sides of the legs in a sciatic distribution. Then you start to really consider things like stenosis, or even maybe sometimes it's more rare, but you can have a central disc herniation where the disc actually herniates into the spinal canal and puts pressure. And anything that's within the spinal canal is always harder to treat than anything outside of the spinal canal,
sure.
right?
Yeah.
So that's a very important thing to try to determine because people do come in and they sometimes will feel it more on the right. And then they'll say, yeah, but every once in a while I get it on the left. And as soon as I start hearing that the symptoms are on both sides, I start to think of things more within the spinal canal itself and affecting the spinal cord. And again, you have to be careful with that type of stuff. With a really bad disc herniation, you can get something called cauda equina syndrome.
What is that?
Cauda equina is essentially where you would lose control of your bowel and your bladder because of how much nerve pressure is being caused. And that's a medical emergency. So anybody out there that's ever been told that they have a disc herniation and they're undergoing treatment, most healthcare professionals would tell them that in rare instances, a disc herniation could develop into where the actual nucleus pulposa goes into the spinal canal and impinges on the spinal cord, which could potentially lead to cauda equina syndrome. And if anybody does have symptoms like loss of bowel bladder function or what we call saddle anesthesia, which is just basically loss of sensation in the genital area, that's a medical emergency because they have to take pressure off of the nerve at that point in order to not make those deficits sustained over a long period of time.
Is this something you would treat, or you'd send them to
that would be going to the emergency room. We've picked it up in the office, right? Because people think they have a disc herniation and they'll come in and they'll say, it's weird. Today I started, I feel like I can't control my bowel and like things are happening. And you can do a couple quick tests in the office to gauge if it is. And then you're going straight to the emergency room.
No
for that.
kidding.
Yeah, that's a medical emergency. That's a 911 call.
Wow,
for sure.
We'll take a quick one. Open lines 416-870-6400 star 640 on cell. We'll take your calls and get to lots more here on a 2-hour edition of the Dr. Payne Show. It's Talk Radio AM 640. Yeah, 11:24. We have plenty of time to talk to you this morning. Got phone lines open 416-870-6400 star 640 on cell. You got health, you got pain concerns. Bring them on. Dr. Lou's here to talk to you about those. Tanya, good morning. How are you?
Good. How are you?
Good. What's happening with you?
I have a tear, complete tear in my two tears in my rotating cuff shoulder.
All right.
Okay.
And it's just I want to find out after the surgery, from your experience, what's the chances to completely be rehabilitated?
Right.
Yeah. Do you know which one of the muscles is affected?
No, they just said two, and I don't. Sorry.
Okay. Yeah, so just a little bit of background. So the rotator cuff is a group of muscles that holds the shoulder in place. 3 of the 4 prevent one movement, one type of movement, and then there's another one which is called subscapularis, which prevents what's called internal rotation, so bringing your arm towards your body. That is probably the most important muscle of all of 4 to rehabilitate after surgery, only because the effects of 3 versus 1. So there's 3 on one side and 1 on the other side. So oftentimes in my experience, rehabilitating all the muscles are important, obviously, but definitely rehabilitating the one that resists internal rotation is very important. The other thing about rehab is that's often done wrong is understanding the way muscles contract. So the easiest type of contraction is what we call isometric, which means you can activate a muscle without causing any movement. So imagine your bicep and you're just holding it out and you squeeze your muscle. There's no movement happening, but you've activated the muscle. That's the easiest form of contraction of our muscle. Then you have what's called concentric, where you can actually, it's the typical dumbbell curl. You pick up a weight and you flex your muscle. Then the hardest type of contraction is where you would start where the muscle is shortened and load it eccentrically, negatively. And so that's a very important aspect in rehabilitation is graded rehabilitation from isometric to concentric to eccentric. And that's much harder to explain, obviously, over the radio and phone than it is to show somebody. But those are the big things with rehab of the shoulder and especially the rotator cuff. My assumption is if you're getting rotator cuff surgery, has your shoulder been dislocating?
No,
it's just tears.
I'm a professional. I used to be a professional tennis player. So.
Oh, okay, yeah. So if there's tears in there, and I guess there's a lot of mobility. Oftentimes, rotator cuff surgery is done if there's an instability in the shoulder. And so, again, I'm not sure with your specific case, but definitely the surgery will make the shoulder stable. The only downside to having a stable shoulder after surgery is you tend to lose a little bit of range of motion. And that's just kind of the reality of doing surgery. You don't really have an option there. So, but as long as you get the right rehab after, your recovery will be very good. It's just a matter of, again, doing the right rehab. That's stuff that my clinic can help with. Tanya, if you're interested after the surgery, give us a call.
Okay. All right. Thank you very much.
No problem.
Thanks, Tanya. 1-855-55 Dr. Lou, by the way, is that number. 1-855-DRLOU. We'll get to Frank. Hey, Frank, good morning.
Morning, guys. How's it going?
Good, Pally. What's going on with you?
Not bad. Just a quick question for Dr. Lou. I've been doing some research online, and I have been to both. But what is the difference between, and which one do you prefer? Chiropractic care or osteopathic care? Which one's better for you?
Loaded question. It depends. We can do a full history class over 2 hours on where both originated from and what they both do. What I'll give you the quick, the Coles notes type of things. Chiropractic is a regulated profession in Ontario. Osteopathic practitioners are not regulated in Ontario. And so that's very important from protection of the public. So I'm sure you've heard of the College of Physicians and Surgeons. Well, any regulated profession has a college, such as chiropractors have the College of Chiropractors of Ontario, the College of Physiotherapists of Ontario, the College of Accountants of Ontario, et cetera, et cetera. Colleges exist to protect the public. What that means is if you go see a chiropractor and something happens that you don't really like, you have a body to complain to that will take action against that person. Osteopathic practitioners are not they're not regulated in Ontario, which means they don't have a regulatory body that protects the public. So that's number one. Now, that doesn't mean there's osteopathic people out there that are not good. I have osteopathic practitioners working with me. Originally, osteopathy started in the States, and in the States, it's called a doctor of osteopathy, and it's very similar to a medical doctor, actually. They actually practice almost the same way. They do surgery. Here in Canada, I think it was around the 90s, they didn't allow doctors of osteopathy to come in or whatever. So osteopathic practitioners were created. It's oftentimes to get your osteopathic license is something like 6 months, and it's like on weekends. So the education is very different versus a chiropractor has gone to undergrad for 3 to 4 years and then does another 4 years of a professional education and gets a doctor of chiropractic degree, right? So education is different. They're classified as doctors. They can diagnose. And again, I'm not going to answer which one's better or not better, because I do really believe more than looking at professions is more important is looking at individuals. And so there are some osteopathic practitioners out there that are very, very good. And they may even be better than some chiropractors. But as a general thing, I can't say for sure. I just think you should be educated on the difference in terms of what education is, scope of practice, regulation, and those types of things are very important towards making that choice. But like I said, like I'm a chiropractor myself, but I have osteopathic practitioners that I refer to that work with me when I believe it's going to be indicated. So, you know, again, it's not a matter of better or worse. It's about the right person for the right thing that you have going on.
Yeah, because I know quite a few people that do go to chiropractors for certain ailments, right? Whether it's like lower in the sacroiliac area, or if it's the upper thoracic, lower thoracic region, or the neck.
Yep.
And they always feel that they go there, they get the same quick crack and they're out in 10 minutes, and they still don't really get there. So what's the difference between a good chiropractor who really knows what he's doing and a guy there who's just to make money, give you a couple of cracks, and get you on your way?
Well, that's already kind of in my books. You know, and again, me being a professional, one of the things about being a professional is I'm not supposed to badmouth people within my own profession and other professions. But what I will say is that, you know, people are very smart. If you feel like you're getting ripped off, chances are you are getting ripped off, right? So if someone's only spending 2 minutes with you or 3 minutes and that's not working for you, it does work for some people. But if it's not working for you, there's plenty of chiropractors that don't practice that way. Give me a call. I can help you find those people. Those are the types of chiros that I hire.
We'll take a short break. Your calls 416-870-6400 star 640 on cell. Got some open lines. Bring it on. We're here till 1 o'clock this afternoon. The Dr. Payne Show, Talk Radio, AM 640. 11:34. We're here till 1 o'clock at the Dr. Payne Show. 416-870-6400 star 640 on cell. After the show, by the way, if you need to get a hold of Dr. Lou, info@paincarecanada.com. And Dr. Lou, your number 1-855-55 Dr. Lou, DRLOU. Sam, thanks for hanging in there. What's going on?
Hey, I hope you guys can hear me. I'm just on the car and the speaker.
Yeah, we're good.
Okay, good. I have in both feet chronic bilateral plantar fasciitis. Very bad, very sore. Working on my feet for 20 years. I just found out I had just went for X-rays, and the guy told me that I have 3 bone spurs. Two on one foot, one at the ball of the feet, one at the heel, and then the other one is just the heel. What do you do? Like, is it? Do you go for surgery for something this serious? Like, I can walk maybe for 2 hours, 3 hours a day, and that's it.
So, okay, a couple things. Spurring happens over a very, very long period of your life. That's not something that would have just happened, you know, yesterday. Sometimes the spur can be the cause of the pain, yes, but not always. And so oftentimes one thing that's done wrong with plantar fasciitis is X-ray shows heel spur is cause of pain. Wrong. That may not be it. It may just be the plantar fascia is being aggravated and has never been treated the right way or having the right time to heal. So yeah, if the heel spur is the cause of the pain, then yeah, maybe considering getting it removed may be an option. But again, it really becomes, is it the real source? Is it the pain generator that's causing the plantar fascia to become aggravated? Yes or no? And that's the harder question to figure out. And the harder answer to figure out. Does that kind of make sense?
So, yeah, I mean, it does make sense. I've been seeing a massage therapist, right, for the feet, and she keeps saying that you got to stay off your feet for at least, 2 weeks, 3 weeks, just to let that muscle heal.
No.
I'm saying that correctly?
No, it's just that. Yeah, I'm only laughing because that's just, how do you tell somebody stay off your feet for 2 weeks? Like, even if you had to go to the washroom, you couldn't stay off your feet. No. There's a very specific way to treat plantar fasciitis. And in all honesty, it sounds like you're probably not getting the right way to have it treated. Oh. So I'm sure if you had better treatment, you may have better outcomes. This is exactly the type of stuff we deal with. Where are you calling from?
Toronto.
Yeah. So give us a call. I'll set you up with somebody who can treat this the right way, get you better. And it shouldn't. Plantar fasciitis is not something that should ever become chronic. Like, it can reoccur, but if you treat it the right way, you should definitely be able to minimize the symptoms. There are a lot of home care things that you could do, but one of the recommendations would never be stay off of it for 2 weeks, because it's just not possible, right? So there are ways to keep the plantar fascia from being aggravated without staying off your feet. And those are things that you'd have to go through with somebody, and it's kind of hard to explain over the radio. But yeah, it's definitely something that can be treated. Okay.
Can I ask one final question?
Yep. Yeah, for sure.
What do you think about night splints? Because, I bought a pair of those, and, to keep that muscle stretched, if that makes sense. I guess it does.
Yeah, so the bigger thing with plantar fasciitis is most people will complain that first thing in the morning is when it's worse. And again, because I don't have a visual aid right now over the radio, your foot is essentially a spring. So every time you take a step, there's a little bit of springiness that happens in the foot. Those splints tend to keep you in the high end of that spring while you sleep. But the more important part is, how do you not flatten it when you step? So yeah, those splints can be an important part of the treatment, but it's not the final step. There needs to be an intervention for once you take your first step. And usually what I recommend to people before they get out of bed, if they have plantar fasciitis, the plantar fascia is a tissue like any tissue, and more important than stretching tissues is keeping tissues warm. So if you have plantar fasciitis, before you get up, move your foot around, give it a little bit of self-massage, get the tissues warm. It makes the enzymes work, and then take your first step, take it slowly, gradually add weight to your foot, like as you sit from the bed to the floor, add a little bit of weight. Warming it up is much more important than stretching it.
You mean like blood circulation?
Correct, yeah.
Yeah.
Oh.
Yep.
All right. Thanks, Sam. By the way, 1-855-55 Dr. Lou. If you need to get a hold of Dr. Lou to make an appointment, got Ralph here. Good morning, Ralph.
Good morning.
What's going on with you?
Well, I just got a diagnosis of CLL.
Okay.
And my question, and I don't think there's a whole lot of pain associated with it, but it's about second opinions.
Yeah.
And the best way to ask a doctor for a second opinion. I always think it's kind of maybe a downer for the doctor to hear that, but is that pretty accepted in that industry?
Well, it's funny you should say that. I had a patient this week who was supposed to come see me and called and said that, I guess they spoke to their family doctor, and the family doctor essentially said, if you go see someone else, you'll be de-rostered or taken off my list. And it's like, again, why regulated professionals? If people are doing that, if people are treating you the wrong way because you want a second opinion, call whoever the regulatory body is, whatever college controls that professional. Because if my patients come to me and say, thanks for what you're telling me, I want a second opinion, no problem. Yeah. That's what you're entitled to. It'd be the same as if you went to go buy a car and said, I'm going to go shop around. Well, if you do that, don't ever come back here, right?
Right.
Okay, fine. I guess I won't. Maybe you don't want to be seeing that person. But no, I don't think in general, most good healthcare practitioners, I don't think would ever have a problem with anybody getting a second opinion.
No All right, problem. Appreciate that, Ralph. Seriously, right? Don't you ever come back here.
Yeah,
you don't trust me. I don't ever want to see you again. Okay. 416-870-6400 star 640 on Sell More. Your phone calls coming up right here on the Dr. Payne Show, Talk Radio, AM 640. It is a 2-hour show this Saturday, right till 11 o'clock, or pardon me, 1 o'clock, start at 11. It's a beauty. Love doing these. 416-870-6400 star 640 on Sell. Sandy, good morning.
Hey, good morning.
All right. What's going on with you, Sandy?
Thanks for taking my call, first of all.
No problem.
I have had a sprain on my right ankle about 7 years ago.
Mm-hmm.
And recently I've been going to the gym regularly, and I'm starting to feel like an imbalance on that ankle, almost the leg.
Sure. Can I ask you, on the ankle that's sprained, was it on the outside or the inside?
I wouldn't know because I just use home remedy. And
I see.
It was swollen, and when it was healed and I could walk on it, it was fine. Sure. I never had X-ray or anything done on it.
Okay, so the ankle, the most commonly torn ligament in the human body is the ATFL, which is the ligament that attaches, essentially would be the tibia to a part of the the tarsal bones in the ankle. And so what happens is you can have different grades of sprain, whether it's a grade 1, grade 2, or a grade 3, which is a complete tear. Oftentimes people do get a grade 3 tear. And again, it'll be fine day to day if you're not really doing anything after the initial, swelling and stuff subsides. But then as soon as you start to try to get more active, like you're mentioning, Sandy, there could be issues because what ends up happening is you have an instability in that ankle now because you're missing a ligament. And if that's the case, wearing some type of a support may be the option. But again, I wouldn't know for sure without actually moving your ankle around if that's the problem. And if it is, then again, it would just be a matter of you doing the right things to support that ankle while you're doing your activities, because there's no other way to support the ankle in the absence of, getting it fused by a surgeon. But no surgeon would want to do that because it would just create a whole constellation of new problems. Does that make sense?
Sort of.
Okay. Yeah. Well, I guess if you really are interested in figuring out what the problem is, again, this is a perfect example of where my assessment would be able to figure it out, and then I could give you very specific answers.
Oh, okay.
Okay.
So how do I get to?
You can leave your number with the call screen, and I'll have someone from my office give you a call, or the 1-855-55-Dr. Lou, and it's DRLOU. Is the number you can call.
1-855-55-Dr. Lou. Got Isabel. Hi, Isabel.
Hi, sir. How are you?
I'm good. How are you doing?
Good, thank you. I have a problem it's been about a couple months now. What I do is I wake up in the middle of the night and in my hands are both sleeping. Like they get tingling, numb, and they hurt.
Mm-hmm.
So I'm not sure what is the cause of that.
Yeah. So again, it's a neurological type of symptom. So you got to consider all options. Could it be something like a muscle impinging on the nerve? Could it be something at the neck? Could it be something on the spinal cord, something in the brain? What I will tell you is most often when it happens only during the night, it's just due to poor sleeping posture, something where you're putting your arm a funny way, and that's creating pressure on the nerve and it's causing your arms to fall asleep. It's even something that I get. So, but you can never be sure without ruling out everything else as well. But that's what I see as often the most likely cause when people wake up with pain is just simply due to awkward sleeping postures, or whether they're using too much of a pillow or too little pillow. They're sleeping a different way. They've got some new things. They now have, they're in a relationship, they're sleeping with someone, they're cuddling, that can create pressures, all this different type of, it's
physical pressures.
Yeah, physical pressures, yeah. So it is possible, right? So again, it would be something that would need to get assessed in order to determine that there's no other potential cause. And then if there's no other potential cause, it's likely just simply due to poor sleep posture.
Okay, and I can get in touch with... I left my number.
Great.
So
Perfect.
Can you have somebody to call me?
I
You
will.
bet.
Yeah. So as long as we have your number, because I see here it says unknown, but
yes, it's unknown. Yes, but I gave her to...
Okay, sure. Yeah, no problem. Yeah, I'll get someone in touch with you.
We'll take one more, I guess, quickly before the break, and that will be Antoine.
Yes.
How are you? What's going on?
I have in and out, but mostly in back pain. I had a car accident, and then a month later, I had a slip and fall. So I did some X-rays and everything like that. I went to physio. They did acupuncture, massage. I call it a shock treatment, but I know it's not called that. Like pulsation of...
Yeah, I know what you're talking about, like a shock wave.
Yeah.
Yeah.
And also the physio said get a better mattress. I did that, and I still get in severe pain, and I don't know where to go from
Okay,
there.
let me ask you something. How much active stuff have you done? And what I mean by that is, did they show you exercises? And if they did, have you been doing those exercises, like the graded rehabilitation?
Yes, I have.
Okay, and you've been following through with it, doing all the right exercises that they've showed you?
Yes, I have.
Okay. Yeah, I guess, that would have been based on what you were saying, my thought that maybe rehab wasn't part of the treatment plan. But if it is, then I'm not really sure why things are not better. And it's obviously hard for me to say for sure over the phone. But if you like, come in for an assessment, we could take a look at it, and I can give you a specific answer as to maybe why it's not getting better.
Yeah, that would be great.
Okay, awesome.
Antoine, again, 1-855-55 Lou, DRLOU. For you as well. Jim, I see you on the line there. Hang on, big fella. We'll get to you. 416-870-6400, star 640 on cell. Still got some more time to talk to us this hour. Then we're going right to 1 o'clock. The Dr. Payne Show, Talk Radio, AM 640. 11:53, a few more minutes here. You want to call in? We're going to go after 12 o'clock, of course, right till 1. We'll take a short little break for the news. Jim, thanks for hanging in. How are you?
Jim here.
Hey, Jim, what's going on?
Okay. I think a sciatica problem.
Okay.
Here's what happened. Last week I got a bad cold, and coughing was really excruciating, and my chest, and I think I threw my back out.
Yep. Okay. It's possible.
I got up in the morning. This is about 3-4 days ago. I had this excruciating pain on my left hip.
Mm-hmm.
And it's bad that I almost passed out when I try to get up and walk.
Right.
And but after I sit up for a while, it gets a little bit better.
Mm-hmm.
But now the pain has moved over towards my groin.
Yeah. Okay.
What do you think's going on there?
Yeah. Well, so a couple things. One of the things that can often, blow a disc is increased internal pressure, such as through sneezing, coughing. I hear that a lot. Yeah. So potentially a nerve could have been set off. A disc may have bulged and is putting pressure on nerves. And a lot of the nerves in the low back do go to the groin area and those things. So it may be higher than the sciatic nerve. There's other nerves besides the sciatic nerve, right? And so it may just be the disc herniation is affecting a different nerve root, and that nerve root just so happens to go into the groin area and is causing those symptoms. But again, you'd have to get the proper type of an assessment in order to determine if it is a disc herniation going on, or is it something else? Sometimes it could be even things like just myofascial pain, which is referral of muscle. There's some muscles like the external obliques that can refer into the groin area. It could also be an actual groin issue, right? So there's a lot of things to consider there that could have happened. But based on the history that you're saying with the coughing and throwing out your back, it sounds like you probably aggravated a disc. And it's probably higher up, maybe L1, L2, that area, and it's putting pressure on the nerves that go to the groin region.
Very good.
Okay.
Very good. Yeah, very interesting. Will it go away eventually?
There's always natural history, what we call natural history to most problems. The question then becomes, does it go away the right way so that it, you minimize its chances of coming back? It depends. It can go away on its own for sure, but not always. And it's really very much based on the individual and the things that you do. But I would encourage anyone going through those types of things to get it looked at by a professional. And then they can kind of educate you on the things to do to avoid, and then go from there. Because, a lot of times leaving these things and trying to let them heal on their own, all it does is increase the likelihood that it's going to come back one day.
Right.
Yeah. Okay.
See, I'm not in Toronto. I'm in Midland, Ontario, so I'd have to look around for a professional up here, I guess.
Yeah. Well, give me a call. I have a provider network, so I can get you in contact with somebody. If we have your number, I'll make sure to get in touch with you, and I can help you find someone up north that can help you out.
Very good.
Okay.
Thank you very much.
Yeah, no problem.
Thanks, Jimmy. The number 1-855-55 Lou. You mentioned a short time ago about good pillow, bad pillow. How do you know? What do you like? It's how much you spend, or
Not necessarily.
Yeah.
It's more about the key with sleeping is making sure your spine is neutral, and so that really depends on how do you sleep. For example, if you sleep on your side, well, there's a greater space between your ear and your shoulder than there is if you were to sleep on your back,
sure.
Right? So that would change how much of a pillow you would need just based on that. Sleeping on your stomach is probably the worst thing for your spine. I'm kind of a hypocrite because that's how I sleep. But it's just
with your head turned.
Yeah.
You don't wake up with a sore neck?
I got tons of problems.
I can't even lie like that.
I've tried to change, but no matter what, I wake up that way. But so that's not a good thing. So does it really depend on price? Probably not. It probably depends on comfort. One of the biggest things, and thankfully the day and age that we live in, is reviews on these products, right? So I think that's a big thing. If the majority of people that are using a product say it's good, it's helping them, then that's probably better than just relying on, is it more expensive or not? And we use a pillow that I sell a lot of, which you put water in to change how much of a pillow that you need. And most people love it. And I actually came across it by accident. It was given to me as a graduation gift from the college that I went to. And, I kind of thought, okay, whatever, I don't want this thing. And I gave it to my girlfriend at the time. And then I remember sleeping over once and using it. I was like, this thing is incredible, right? And so
I'm taking it back.
Yeah, and so then I had to go buy my own because she didn't want to give it back. But ever since then, and we've sold thousands of these pillows in the clinic, and we've never had a complaint. People love
a water pillow.
Yeah, it's a pillow that has like a pocket inside, and you put water to kind of see how much of a pillow you want or don't want, and yeah, it's great. People love it. Yeah,
set a brother up.
No problem. I'll bring you one next time.
I had a water bed, back in the 70s, but that's a different story.
I don't know if the water bed is a good idea.
No, not at all. We'll take a quick break. Get your phones ready. We're here for another hour of the Dr. Payne Show. When we come back from the news, of course, 416-870-6400, star 640 on cell. We'll talk to you on the other side. Talk Radio, AM 640. It is 12:04, hour 2 of the Dr. Payne Show, 416-870-6400, star 640 on cell. Got Len on the line. Hey, Len, good afternoon.
How's it going?
Good. What's going on with you?
I was in a bike accident in the summertime and kind of tweaked my shoulder, broke my shoulder blade, and I ended up having some disc problems, and they're talking about possibly sending me to surgery. But I don't really want to go for surgery. I was just wondering, is there any other suggestions? I am going to a chiropractor already and doing ART, but there's some issues with the shoulder still in the back. And a lot of pain.
So I missed the first part. You fractured your scapula, you said?
Yeah, I broke my shoulder blade in the bike accident.
Okay, and then
I'm having shoulder problems. Like now, I'm having shoulder problems.
Right.
They can't really figure out what's going on with it.
Okay. So can I?
Sorry.
No, I was just simply going to ask that when they've recommended surgery, what is their reasoning for the surgery?
Because they're wondering, they want to send me for an MRI.
Right.
And then they say you might have to go for surgery on the shoulder because there might be something wrong with like the ligaments or the tendons.
Right, yeah.
Because I'm having issues like putting my arm like kind of like a tennis swing, right? I can't do that.
Okay.
Like kind of bring it backwards.
Yeah.
And anything up to a certain point, like kind of like if I lift my shoulder like an upright row, I can only go parallel to my shoulder. I can't to kind of go past that point.
Right. Well, I guess the answer would be that it would depend what the MRI shows and then what they're recommending the surgery for. So, for some things, I think surgery is absolutely necessary in the shoulder, and for other things, I think there might be better options. An example is, let's say, someone who's having chronic dislocations and their ligaments are weak. The surgery for that is great, and it really provides stability. Something like a labral tear in the shoulder really tends to respond well to surgery. Something like a partial tear, maybe not so much, right? So it really depends on why they would be suggesting if surgery is the option, and that'd be the thing that I'd be more interested in reviewing to really understand and then give my recommendation based on that.
I also broke my shoulder blade, and everyone I talk to says it's a very rare case that people break the shoulder blade.
Yeah, it is rare. I don't hear that often, that's for sure.
And now it happened in July, and I'm still really tender in the side. Like, is that just bruising, or?
It might just be, kind of, the aftermath of everything going on. I don't know that it would still be bruising. Is the fracture healed now?
I haven't gone for another X-ray yet.
Yeah, so that's important too. A lot of times, fractures in weird places can linger, especially if there's no good inherent stability in that area. And I could potentially see that, something like a shoulder blade fracture, because there's no way to really stabilize that. Right. There might still be some fracture going on. And, the other thing you have to understand about the body is when there's an injury to a certain area of the body, oftentimes the pain isn't always necessarily due to the area that's injured. It's due to the other areas surrounding trying to pick up slack. And slack creates fatigue, and fatigue creates pain. So that may be the other reason why you have pain going on still in that area.
Yeah, if someone slapped me in the side or even punch me in the side, that guy would just drop.
You'll yell.
Yeah, yep. Yeah. So make sure nobody punches you in the side.
That's rule number one.
Rule number one.
Other side, fine, not this side. 416-870-6400, star 640 on your cell. Alex, good afternoon.
Hi, how are you today?
Good, pal. What's your concern?
I went for an MRI in September, and I have a torn meniscus in my knee as well as a Baker's cyst.
Mm-hmm.
So I'm wondering if there's any way of avoiding, surgery, and if there. I guess that's the question.
We lost you a little bit there at the end.
Say it again, Alex.
I had a MRI done in September, and
Yep.
I have a torn meniscus in my left knee as well as a Baker's cyst behind my left knee. So I'm just wondering, is there anything we can do about that besides surgery?
Do you remember what type of a tear it was?
No, I don't, to be honest with you.
So that kind of matters on the type of tear. Do tears always need to be treated by surgery? No, you could try other types of therapies to try to get the knee better. The Baker's cyst in the back, Baker's cysts tend to happen anytime there's a meniscal issue. What a Baker's cyst is essentially within the knee, there's something called synovium, which is the fluid that lubricates the knee. And sometimes if there's stuff going on with the meniscus, there'll be a little bit of leakage of that synovium, and it'll create a pocket-filled cyst called a Baker's cyst behind the knee. Now, as long as that Baker's cyst doesn't start to push on, the nerve or other muscles, and it doesn't generate pain, it's often what we would just call an incidental finding. You just noticed it because you ended up having an x-ray. So if it's not really bothering you, that's probably, not something to worry too much about. The tear is probably what's causing you more pain. And it does depend where the tear is, the type of tear. And based on that, then I would really be able to suggest whether surgery is the best option or not. I see I think you've left your number with our call screener. Maybe if you find that information out and then we connect later on in the week, I can give you a better answer.
All right, then. Thank you.
Okay, no problem.
Thanks, Alex. We'll take a quick break here. Marco, I see you there. Everyone else, 416-870-6400, star 640 on cell here till 1 o'clock. Bring on your calls, concerns. We can take them right up until the end of the show today. The Dr. Payne Show, Talk Radio, AM 640. 12:14, right till 1 o'clock, 416-870-6400, star 640 on cell. Marco, good afternoon.
Good afternoon. What a topic. It suits me fine for today. I have an issue. It was my right shoulder first. Then I went to acupuncturist, a Chinese guy. He did about 9 treatments and about 2 injections into the shoulder. He solved that problem. Then he says, if I don't do the other side, it can become the same problem like the right side. Now, this left side is so bad, I'm losing the muscle from the shoulder to the elbow. What can I do to assist it?
What do you mean losing the muscle?
It's the hand. The arm is getting smaller.
Okay. Well, that's anytime you start to see visible atrophy of muscles, that's usually due to some type of a neurological claudication where the nerve is not providing nerve energy to that area. So you need to figure out exactly why that's happening, right? Because that could potentially be very dangerous. For that to be happening. And, in terms of how do you treat it, I don't know, because we'd have to see exactly why that muscle is atrophying. And that's very, very important to get an answer to that.
So how do I make contact with you guys?
Do you have a pencil or a pen?
Yes, thank you. Yes.
1-855.
1-855.
55. DR.
E-R.
D is in Dr. Lou.
Dr. Lou. D-R-L-O-U.
L-O-U?
You got it.
And then when you call the number, press 1. It'll take you straight to my main clinic, and they can help you book an assessment.
All right. Whereabouts is your clinic, though?
Where I specifically practice is Etobicoke, but if it's you want something closer, I can find someone in my provider network to help you out.
I'd appreciate that. I'll leave my number with the
awesome.
with the screener.
Okay.
Beautiful.
Thank you.
Good. Thanks, Marco. I appreciate that. Rosa, good morning.
Good morning. How are you?
Good. What's going on with you?
So I've been a runner for the past 20 years, and all of a sudden at the end of the summer, this past summer, I started getting lots of hip pain. And so I went to see an orthopedic specialist, and he told me that I had bursitis on the left side.
Mm-hmm. Okay.
And so I haven't been able to run since December, and obviously that doesn't work well with me. But so he prescribed intense physiotherapy, which I'm starting this week. But just wanted to know a bit more about that, or can I continue to run? Like, what are my options?
So, okay, where are your symptoms exactly?
It's usually on the left hip.
Where on the left hip?
Right by the bone, the hip bone.
Right at the hip bone, on the side?
Yes.
On the side, yeah. Does it hurt in all ranges of motion? Like no matter which way you move your leg, there's pain in that area?
No, it's usually if I'm sitting for an extended period of time or if I exercise and then it'll begin to hurt. But when I'm in motion, it doesn't hurt too much.
Is it
after the fact?
Yeah. Is it a sharp pain?
Pretty much. It's a continuous pain.
Okay. What can you just describe the character? Is it very sharp just in that area, or is it the whole region?
No, it's probably from my hip bone to, I guess, just where my bum would start.
Okay. Yeah.
Around the area.
Okay. So
yeah.
It sounds like it could potentially have a component of bursitis, but it may also have a component of muscular issues surrounding it. So it would be important not just to treat the bursitis, but also treat the surrounding tissue. And most good therapists will do that regardless. So as long as you have a good person that you're about to see, that shouldn't be an issue. Should you be running? I guess it's really about, in the first week and a half of starting the therapy, I would say probably no. But then that's where you have the conversation with your treating professional where you kind of start to reintroduce whatever you're doing. So oftentimes when you're off of whatever activity is that you like to do, the worst part is not that you go back, but that you go back the same way you were going in December. So it's now March, right? So 2 months have passed. So just as an example, if you were running 5 kilometers before, you may want to start with, a low intensity jog for maybe a kilometer once you do start again and try to reintroduce your body into the activity gradually versus jumping right back in at where you were, because that'll be more likely to recreate the issue than if you reintroduce something slowly over time and grade it.
Okay, that's fair.
Okay?
Okay, thank you so much.
No problem.
There you go. We'll take a short break. I have phone calls. Want to bring them on? We'll got some time to talk to you right till 1 o'clock this afternoon. 416-870-6400 star 640 on cell. By the way, emails anytime, info@paincarecanada.com. Dr. Payne Show rolls on Talk Radio, AM 640. 1222, the number 416-870-6400 star 640 on your cell phone till 1 o'clock this afternoon. The Dr. Payne Show. Dr. Lou is here. Dan, good afternoon.
Hey, how's it going?
Good, Danny. What's happening, pal?
All right, man. So I'm 27 years old, and I'm really heavy into bodybuilding, and I have been for the past 5-6 years. And I did have a mild shoulder injury a few years back, and I did go to chiro, and I did get some massage therapy done on that. And I've been taking glucosamine and other joint support supplements prophylactically since then. I just want to see what your opinion is on taking them in a prophylactic state, if that's beneficial.
You mean specifically the glucosamine sulfate?
Yeah.
For the shoulder injury?
Well, just for overall joint support, because I put so much stress on my joints on a daily basis, especially when you're bodybuilding, right? So and I don't have any problems right now, but I'm just wondering if taking it, over a long period of time when I'm young like this, if that would have any problems in the future.
Yeah, so it's a good question. And I spoke about this a few weeks ago about glucosamine sulfate. And I like the fact that you want to take it more from a preventative standpoint because you're putting a lot of load on your joints. That's the right time to be using these more natural supplements versus people who develop pain. I have lots of people who develop knee pain and then they'll say, should I take glucosamine sulfate? It's like, well, yeah, if you started, 5 years ago, it may have helped to prevent this, maybe. And even then, the research is questionable. You can't even say for sure. But I would say with anything that's more of a natural occurring substance, they take a much longer time to actually have an effect on the body. And therefore, taking it, such as you're doing more from a preventative standpoint, is probably better than taking it from a treatment standpoint. So it may not necessarily help with the shoulder problem that you're currently having, but it may help to diminish the likelihood of other joint problems happening, or at least maybe diminish their severity if they do happen. So yeah, I think that's kind of the right approach if you are going to use something like a glucosamine sulfate.
Okay. Is there any, because I know when I go in the store, they got the glucosamine, chondroitin, MSM combo.
Yeah.
Do you think that one is better than the other?
like all supplements, it really comes down to the ingredients they're using, it, how they get those ingredients. Like it's more about the production of those things, because there's a lot of bad supplements out there. And if you're heavy into bodybuilding, I'm sure you've done a lot of research on things like good protein shakes and bad protein shakes. And so it's the same kind of thing with glucosamine sulfate. Like, where's it coming from? Is it synthetically made, or is it actually coming from somewhere? Those are all things that would increase its potency and potentially make it better.
All right. Cool, man.
Okay,
Thanks.
no
I really
problem.
appreciate you guys' time today.
No problem.
Thanks, Danny. Appreciate it. Talk a little more about that. Like, you go into a health food store, you want to take supplements, you're working out, maybe you want to get in a protein or creatine or something. Where do you start? It's like an endless,
So, one of the problems that I think has occurred is we look at bodybuilders, which are essentially professional athletes who bodybuild. That's different than you and I going to the gym for an hour a day. A professional bodybuilder is working out, 6-7 hours a day. They need that extreme level of protein. I remember one of my professors, he was actually a sports doctor for the Raptors, and he used to say that, the average person taking protein, all you're doing is creating very expensive urine, because a lot of it just gets wasted. Like, there's only so much protein that your body needs and that will use before it starts to excrete it and get rid of it. So it really depends. Now, what if you're, say, a vegan or a vegetarian and you don't get a lot of protein in your diet? Maybe there's an argument there for should you supplement with something like a protein shake? Also, maybe you're undergoing an injury and you want to help heal, and so you need a little bit more protein. And it really depends on the individual. It's hard to say in general, are these supplements good or not? Something like creatine is a totally different perspective. It's all for energy. It's the way, from a biochemical standpoint, your body uses energy in different ways. And the first 10 seconds of any energy cycle is heavily based on creatine. It's not based on oxygen use that creates ATP, which is like glycolysis and the other metabolism. So can't even speak now. Creatine really creates a burst of energy in that first 10 seconds. So if you want to try to power lift and do more things, then it's really going to be beneficial for that. But in the absence of wanting to do that, it's not really going to help for much else. So it really depends on what the person's specific needs are and what their specific health goals are in terms of what supplement is better. I see a lot of people who come in and, you ask them, are you taking any supplements? It's a question I always ask. And they're on every single multivitamin, this supplement, that supplement, da-da-da. And then, okay, how's your diet? Well, it could be better. It's like, my personal opinion is that supplements should be used after you have a perfect diet, right? Because you can get most of the things you need in real foods. And I'm kind of more of that type of approach. And I'm not suggesting that approach is right. I'm just telling you it's my approach. And then use supplements after that. But it really needs to be understood why you're trying to take something, and, do you need it or do you not need it, et cetera, et cetera.
Because how many guys you see in the gym, they got all full of, pea and vinegar. I'm going to start working out. And then the next step, they go to the nutrition store and they spend $400 with a basket of everything.
Yeah, well, it's again, at the end of the day, it's a business, right? So the health industry, especially that kind of like gym industry, is created a certain way for things to make money, right? And so, of course, they're going to push that supplements. There's always a confounding variable, which is that it costs money and that, it may therefore be a little bit biased, but that doesn't mean that it's not always important. I mean, I know a lot of people that swear by supplements and these things, and it's just not my personal thing to go to, but I think it should be every single person out there should be an informed consumer, and you make an educated decision. Get the facts, understand, look at the available research, because nowadays research is available to all of us. I remember when I first started in school, you had to have special subscriptions to libraries at Harvard, and now there's Google Google research, and it almost has the same stuff that any other place would do. So reading good research, real research, is important to try and understand if these things do have an effect, if they don't have an effect. And, it's a debate that still has no conclusive answer.
And you can't discount the placebo effect, especially when it comes to working out. I swear to God, man, I'm stronger.
Yeah, and if people, exactly, and placebo is important with anything. So, I'm not suggesting that if you're taking it to stop, just do your homework.
Right.
Yeah.
We'll take a short break. Your phone call's got time, 416-870-6400, *640 on cell. Right here, Dr. Payne Show, Talk Radio, AM 640. And you can call the radio station right now till 1 o'clock this afternoon, 416-870-6400, star 640 on cell. You get common terms all the time, right? You get sciatica, bursitis, and then Jody,
yeah,
our producer, says, I got knots in my back. What's a knot in my back? I said, you married? You got kids? Diagnosis done. Right. But what is that? He complains about it, right?
Yeah,
people say that all the time.
People do feel like these knots in muscles. And oftentimes what it is just it's a tender point in that muscle that's probably in a chronic state of contraction. And sometimes that can happen. One of the things, calcium is very important for muscle contractions, even though we, as a society seem to think it's more important for bone, which it is important for bone, but it's also very important for muscular contractions. And a lot of times these knots, quote unquote knots, are just areas of the muscle fiber that hasn't been able to relax. And that's where people say, I've got knots. And they do tend to be more common in, if you had a bodybuilder, you'd find a lot of knots in them because they're putting their muscles under a lot of contraction. But, it's equally just as common if you're dealing with someone who sits at a desk a lot and there's certain muscles that are under a constant state of contraction in that area. You'll get little areas in that muscle where the fibers haven't fully released. And because they don't release, you end up feeling these knots. And so that's where things like massage therapy or, active release therapy or myofascial release therapy, those are kind of the areas that professionals will work on to release them, because then it allows your muscle to work as one unit, because having an area in a muscle that's not moving properly can create a pain type of syndrome. And so removing that, little problem area can sometimes, solve the issue that you've been having.
You mentioned sitting. Would it be the same as standing? Because Jody stands there for 4 hours a day.
Jody does stand there, but the only difference is that he's still, the position he's on the computer doing things, so that's still very similar to using a computer. So him standing really saves kind of his low back, but it doesn't do much for his neck and his shoulder areas because he's still in that same type of posture where he's got to work in front of him on a computer screen. So it's definitely better than sitting all day for sure. But there's still an area of issue where he's still doing those things in front of him. Now, the important thing there becomes, we can't stop what we're doing. Like, I'm not suggesting we shouldn't be working on computers, but then it's funny because you see people working on computers. So what that means is your chest is in a constant state of tension. The anterior muscles are getting tight. And then these people will go to the gym and the first thing they want to do is bench press, right? So offset it. I remember it was a few years ago, the new trainer to the Leafs, I forget his name, when he came in, he essentially eliminated chest workouts from the Leafs training camp, because he basically said, like, you guys, when you're holding a stick, what are you doing? You're flexing your chest. They're always flexing your chest. Why do you need a stronger chest? You need to balance it out with working out the back. So, and that doesn't mean you have to go to the gym to work out your back, but there are simple exercises that you can do to really strengthen the back muscles so you're held in a proper posture. A lot of people have what we would call rounded shoulders, and I'm sure you've seen it, where it looks like their shoulders leaning forward. That's just simply due to really tight pec muscles, and specifically pec minor. And so, strengthening the rhomboids, the serratus anterior, and a lot of those other back muscles, the trapezius, will help to keep you in that proper posture. And one of the things that's interesting with proper posture, I'll get people into the office where we'll do a certain provocative test. And they say, yeah, that's the pain that I have under that test. And then I'll say, okay, let's get you in a good posture and let's do that same test. Pain is gone. That's how important posture is. When you're in a poor posture, it's going to put strain on different areas of your body that's going to create pain.
And you've said in past shows, you said no posture is good posture.
Well, movement,
right? Yeah.
Exactly. And a lot of the times when I try to educate people on posture, it's, I'll show people what's the proper way of sitting. But I don't tell them you're working for 8 hours, so I want you to sit for 8 hours
in a
like
$3,000 chair.
Yeah.
Right? Yeah.
What I want you to do is be cognizant that every once in a while, when you're thinking about your posture, sit in a proper posture. Over time, you'll slump out of it. Right. But as long as you have that thought and every now and then you change it, you're creating a dynamic posture. The other thing that's important with sitting is more important than a good posture or a good chair is get up every 15 to 20 minutes and move around, just like we were talking about at the beginning of the show, where where keeping your muscles warm. It's just as important. Injuries happen when our muscles are cold, when they haven't been used. And so you need to move around. You need to eliminate what's called creep. As you sit there for a long period of time, your muscles, your ligaments undergo what's called creep, which is just a constant lengthening of that area, whether it's the low back or the neck, and that starts to create an instability, and that's very dangerous. So you want to get up and you want to move every 15 to 20 minutes is usually what I recommend.
Lines are open, 416-870-6400, star 640 on cell. You also mentioned, this is a few shows back, and it caught my ear, and we should expand on it. You said, we live life pointing forward, and that makes such a big difference to how you should exercise, right?
For sure. And that's kind of the same thing that I was saying with the computers. Everything we do is in front of us.
Yeah.
Just by
you don't think about it, though.
Well, it has to be, right? Our face is in front and our hands are in front.
Yep.
So it'd be very hard to do stuff behind us. But the reality is fine. We need to accept that reality. But now, again, do the things to offset that extra pressure that happens because everything is in front of us, like not ignoring our back muscles and getting that treated the right way, and also doing the right types of exercises so that way you're creating a balance. Really, the body, when you look at muscular tension in different areas, a lot of the times problems occur because you end up having tightness on one side and weakness on the other. And that's consistent throughout the whole body. And a lot of what we do for treatment is you're trying to find balance. So, where we find a weakness, we recommend exercises to strengthen. And where we find a tightness, we do certain therapies to release. And so that's a lot of what therapy becomes is trying to find a good harmony and a good balance between tissues so that there's a constant state of tension on either side of the body.
So would you say it's fair that the body naturally wants to compensate one side or another to achieve balance, and that can cause problems as well, right?
Yes.
Right.
Yeah, that is fair to say. And that's why you start to get a lot of the times common with like desk jobs and things where people have the neck and upper back, we tend to call that an upper cross syndrome, which is essentially you look at where the weaknesses are and where the tightness is, and your body's just trying to fight that. And it's usually the areas that are under that constant state of weakness that fatigue equals pain, right? So,
Justin, good afternoon.
Good afternoon.
What's going on? What's happening with you?
Every time I work out, I get cracking in my bones, like on my elbows and my shoulders. So you can actually hear it anytime I do my bench press or pretty much any kind of lifting exercise using my arms.
Yeah.
I get cracking.
Okay. How old are you?
45.
45. Yeah. So cracking is, it could be due to some type of wear and tear in that area. So there's degeneration in the joints. It could also just be because maybe you're not warmed up. And as you start to do things, it's like, I don't know if you've ever noticed when you get up first thing in the morning, your hands are stiffer than once you've gotten to use them. So, right. Potentially if you warm up before you jump into a bench press, it might minimize that. Again, it may also just be the reality that, some of those joints are worn and you'll get certain noises coming out of them. The bigger thing with noises that I always say is if it doesn't hurt, it's often not a big problem. But if there's pain with it, that's when you kind of got to investigate and see what's going on.
Right. There's no pain.
Yeah.
It's just annoying.
Right.
Hearing it.
Yeah.
How you say you're 45, Justin? How long have you been training in the gym?
Probably about good 20 years.
Yeah. Well,
okay. Yeah. So wear and tear is definitely going to have set in. Do you warm up before you jump into your exercises?
Sometimes.
Yeah, we're all guilty of that, right?
Yeah. No. So try it. Try warming up. Like just make a point of doing it this week at some point before your bench press. Kind of just stretch out, rotate your arms, get the blood flowing, and then jump into the bench press and see if it minimizes. If it does, then you kind of know it's just probably due to the muscles being cold.
Appreciate the call, Justin. We'll get to more of your calls. The number 416-870-6400, star 640 on sale till 1 o'clock this afternoon. Dr. Payne Show continues. This is Talk Radio, AM 640. 1244, Dr. Payne Show here till 1 o'clock. Your phone calls, as always. We'll get to Alan. Good afternoon, Alan.
Oh, good afternoon. How are you?
Good, man. What's happening with you?
Well, I'm just kind of curious because I'm a new listener here, and I've had a problem for a while. About 10 years ago, I had a flooded basement, and I went a little nuts trying to get things out before they got damaged, and I didn't realize what I was doing, and I guess a couple of nights later, I was in screaming pain in the middle of the night.
Right.
Now, gradually, this seemed to go away. And I suppose recently come back to haunt me. It's not a pain. It's both shoulders, and it's an ache, and it's a pervasive ache. Like it doesn't stick to the shoulders.
Mm-hmm.
I've been taking they call natural eggshell membrane.
Right, yeah.
And that seems to alleviate a lot. My question is, if any of this sounds familiar, is this just going to be something I'm stuck with for the rest of my life? Like, I know I really did some damage there when I was doing this stuff, but it was gone for years.
Mm-hmm. Have you done any type of therapy for this? No. So, yeah, and one of the biggest things with any physical problem that I say is if you have a physical problem, it needs some type of physical medicine. And so seeing some type of a professional like a chiropractor or a massage therapist, a physiotherapist, massage therapist, et cetera, anybody that kind of works in that physical medicine realm is probably going to be a good thing because, it's a physical problem. So your body will respond better to some type of a physical intervention versus, like a biochemical intervention because it's not really a biochemical problem. So I would say in the absence of having tried something like that, try that and I think it'll help. The other thing is we were kind of talking about this before with natural history. A lot of the times things can go away on their own, but then as you mentioned, Alan, it can come back to haunt you because it wasn't necessarily treated and then more so healed the right way after that initial issue. So yeah, I definitely think it's something that you should consider having looked at by a professional.
Well, it did disappear.
Yeah, for sure, and it can, but that doesn't mean that it healed the right way. And again, it's about the long term, right? Like we often think I see a lot of patients that as they get older, they start developing issues, and then when you speak to them, you realize they had a previous injury, but they did nothing to treat that previous injury, and then all that really does is the body doesn't heal the right way on its own. It has a faulty mechanism because, again, we were designed for, 10,000 years ago. And when our body was healing itself, maybe we were going to live another 5-6 years. We weren't necessarily going to live another 60 years. And so the mechanism of healing is often good in terms of getting rid of the pain, but bad in terms of function for long term.
Well, does it make any sense that I'm a pretty active person for my age? I mean... really active. I split my own firewood, I dig my own garden and everything, and that seems to be therapeutic.
Yeah, well, movement would be therapeutic, right? That's what I mean. When I say physical medicine, movement is part of physical medicine. So for sure, if you're doing the right things and you're moving around, it's going to warm that tissue up. It's going to get things going. And yeah, it can be therapeutic for sure.
Yeah, because I was just, I suppose, trying to... ignore the possibilities that somebody would suggest some kind of surgical alternative or something. And like I said, this whether you've heard of it or not, in the right circles, this is apparently a really big thing. This natural eggshell membrane.
Yeah, no, for sure. It's one of the next big thing after glucosamine sulfate.
Yeah.
And yeah, I'm not suggesting that it doesn't work. I think a lot of these things are based individual to individual, and if it's helping you, that's great. And that's really all that, oftentimes I tell patients, all you should worry about is if it helps you and don't worry about the stats for everyone else. But yeah, if you're taking it and you're finding relief with it, then that's great.
Alan's a pretty cool cat. Lives in Toronto, splits his own firewood. I like that guy already. Got Frank. We'll get you in before a break. How are you, Frank?
Pretty good.
What's happening?
And Dr. Lou, I got a problem with medial epicondylitis.
Yep.
Golfer's elbow.
Mm-hmm.
I'm older now. It's getting bad. It's preventing me from doing things like, well, I was involved in martial arts for a lot, so I do like hundreds of push-ups.
Right.
So it's really starting to get painful now.
Yep.
Mm-hmm.
I've tried cold.
Mm-hmm.
I've got a couple of salves, but those are just temporary.
Right.
What can I do?
Okay, so same question as our last caller. Have you had any professional look at it and gotten any type of physical medicine?
No. Because it's getting bad only recently.
Yeah.
Last, say, year.
Yeah. So, and a year would constitute chronic, right? Anything after 12 weeks starts to become chronic, and as things get chronic, they become harder to treat. In the absence, I see lots of people with, whether it's tennis elbow or golfer's elbow. I actually had 3 people yesterday, new patients that all had some type of an elbow issue. And in all honesty, if you get some type of physical treatment for it, it often gets better much quicker versus just trying to do, the home remedies and pressure here and some type of a medication. Again, my big thing is if it's a physical problem, needs some type of physical intervention.
Yeah, well, I've had it most of my life. I played a lot of baseball when I was a kid.
Right.
And I think that might be the cause of it.
Yeah, but that doesn't mean that getting the treatment won't help now, right? So I definitely think it's something worthwhile for you to consider. In the absence of doing something like that, it could just be a problem that sticks around and nags you, may get better again with natural history, but then can come back. And, even with treatment, it could still come back. But usually with treatment, you also become an educated person about the things that would re-aggravate it. And so it tends to minimize the instance or the severity of reoccurrence.
Okay, so I'll look you up and I'll give you a call later.
Sure. Awesome.
Thank you, Frank. It's 1-855-55 Dr. Lou, by the way. Golfer's Elbow. Tell me about it. Come on in, son. The water's warm. Brutal. More of the Dr. Payne Show coming right up. Talk Radio, AM 640. You want to slide in a quick phone call in the last few minutes here of the show till 1 o'clock, 416-870-6400, star 640 on cell. I'm betting that at your clinic with this winter or non-winter we've had, you've seen a big drop in slip and falls, car accidents, because people just aren't slipping or falling as much, right?
Yeah, it's actually a good point. I have seen a little bit less in it, but there's never really a shortage, even though, there is maybe a statistical fall in the whole GTA. We still do see a fair number of the slips and falls. Maybe the slips and falls have decreased because it hasn't been as cold, but for sure car accidents still tend to happen whether weather's good or not good.
Right.
And so you see those things for sure. And, the most common injuries that you get with the car accidents are often spine-related because of the jarring effect.
Whiplash.
Yeah, whiplash, no matter which way the collision is, you just end up having a jarring effect through the spine. And then it's just a matter of getting the right treatment. And I know even when we've had Savannah on the show before, if there's a legal aspect to it, it's important to be working with the right clinic in order to get, a good file going. That way you have a good case. And I know Savannah would agree, it does help your chances when you have a professional and a team that are documenting the things the right way. You'd be surprised how many clinics out there, no matter what the type of clinic is, that don't document things properly or just do really quick notes and things like that. And those things can be detrimental to any type of a legal proceeding, whether it's for a disability claim or a slip and fall or a motor vehicle accident.
Savannah hosts the Insurance Injury Law Show here on 640. We'll have him on again maybe in a couple of weeks.
Yeah,
it's been a while, right?
Yeah.
Got Gary here. Slide you in quick. Gary, what's going on?
The base of my right thumb now has been sore for about a year and a half. I started when I was building a fence in my backyard. A couple of days later, I got severe pain in my hand, specifically in my right thumb area. Doctor diagnosed it as tendonitis, and that made a lot of sense. Treated it with not very much, just sort of rest. It's ongoing. I've had x-rays, and now they tell me there's arthritis in my thumb area.
Okay.
I've had physiotherapy, and I've now seen a specialist, not a doctor specialist, sorry. Went to a hand clinic at South Lake Hospital and Newmarket, and they said stop physiotherapy and rest the hand. So I'm in a brace now for 6 weeks, and the pain is still there.
Yeah.
If I take the brace off, then the pain still exists, and sometimes it's extreme.
How long has it been in the brace now?
It's been about 6 weeks now.
It's already been about 6 weeks. Yeah. As you were telling me all that, I was going to say you may want to stop doing therapy for a bit and immobilize it. It's hard. It could be a lot of things. The degeneration, the arthritis could be a contributing factor. It could be still a tendon issue. A lot of the times, what happens with the tendon sheath is there's a sheath around the tendon, and you can form scar tissue in those areas, which prevents the proper motion of that tendon, which can create pain. In all honesty, Gary, I'd have to see it in order to be really sure exactly what's going on with it. It sounds like you've been doing the right things, and yet you've had no luck to get rid of it. The other thing is maybe at a certain point, If it's still not better after having had it immobilized and there's still a pain component, you may want to talk to whoever the treating professional is, maybe about something like a cortisone injection in the area to numb it out and see if that can provide any relief.
Okay, great.
Okay, yep.
Thank you very much.
No problem.
What's the lifespan of cortisone? I know people have done that. It's not momentary relief, but it's not forever.
It's not forever. It's usually could range as high as about 3 months. Some people swear that they did it once and it's gone away, but it's not necessarily the injection that makes it go away. The whole point of it is that you should be doing it to that way you don't have pain, so you can do the things to get it better. Because a lot of people, for example, will say, well, I want to lose some weight, but I can't because my hip is bothering me, and them losing weight would help their hip. So they end up having the injection kind of to block the pain, and then and then they can do the other things. Now, you also can't do too many cortisone injections in any one area because it's a steroid, and it will decrease bone mineral density in that area. But, in a case like what we just spoke of, maybe that injection in that area gives it enough time where he's not thinking about it. That's the other thing. It's the distraction. You now don't have pain for a period of time. You can start to forget it.
We'll take it for there. We're back here next week at 12 o'clock. Want to remind you of that one, the Dr. Payne Show. In the meantime, 1-855-55-Dr. Lou, DRLOU, to get a hold of Dr. Lou here after the show is over. Email info@paincarecanada.com. Till next time, next weekend, the Dr. Payne Show, Talk Radio, AM 640.